Have you ever asked yourself quietly, maybe late at night, is it still okay that I do this every day? Not out of guilt, not out of shame, just a lingering question that most men don't dare say out loud. You're not alone. Thousands of men over 50 and 60 carry this exact question in silence. We openly talk about blood pressure, cholesterol, testosterone, even sleep. But when it comes to self-touch, silence, hesitation, confusion. So today, let's say it plainly. What really happens to your prostate if you masturbate daily after 60? Is it quietly harming you, or as some rumors suggest, or is it actually protecting you in ways you've never been told? Stick with me because the science behind this may surprise you. And by the end of this video, you'll know how to make this private habit work for your long-term health, not against it. Before we dive in, quick favor. If you're watching this right now, take 2 seconds to hit the like button. It helps more men see this important conversation. And let me know in the comments, where are you watching from today? I love hearing the different places this community reaches. For decades, men have been told all kinds of things about masturbation. That it drains your energy, that it causes prostate inflammation, or even, the scariest rumor, that it increases your risk of prostate cancer. But here's the problem. Most of these so-called truths were based on fear, not facts. Some came from cultural taboos, others from outdated medical assumptions. And when fear replaces science, men stop asking the right questions. They suppress their biology, and sometimes they avoid things that could actually protect them. The good news? We don't have to rely on myths anymore. Today, I'll show you exactly what the research says about daily ejaculation, prostate health, and aging, and I'll explain it the way I would to a patient sitting across from me in my office, with no judgment, just clarity. For those who don't know me, my name is Dr. Nora Hayes. I've been practicing medicine for over 7 years, specializing in men's health and wellness. And I can tell you firsthand, this is one of the most common questions men whisper to me in private. They won't bring it up during their annual checkup. But as soon as the door closes, when it's just the two of us, they'll lean in and ask, Doc, am I hurting myself if I still do this? So let's clear the air with real science. In 2016, Harvard University published one of the largest and most trusted studies on this very topic. It was featured in the journal JAMA Oncology. They followed over 31,900 men for more than 18 years. Most were middle-aged or older. And they asked a simple question. How often do you ejaculate? Then they tracked who developed prostate cancer. The results were shocking. Men who ejaculated more often had significantly lower rates of prostate cancer. Specifically, men who ejaculated 21 times or more per month had a 33% lower risk of prostate cancer compared to those who did it just 4 to 7 times a month. That's not a small difference. That's life-changing. Now, let's pause here. This wasn't a random internet poll. This was peer-reviewed, controlled for age, lifestyle, and medical history. The researchers weren't trying to sell anything. They were just following the data, and the data told a clear story. More frequent release was protective, not harmful. So why is that? Why would daily ejaculation actually help your prostate? Let's break it down. Reason number 1, it clears the pipes. Your prostate's main job is to produce seminal fluid. When you don't ejaculate for long stretches, fluid can build up. That stagnant fluid may increase oxidative stress and create an environment ripe for inflammation. Think of it like a garden hose. If water just sits inside for weeks, bacteria and debris collect. But when you run fresh water through, it clears the hose. Daily or frequent release works the same way. It flushes out old secretions, keeping things clean and balanced. Biologically, this reduces pressure. Emotionally, it gives you peace of mind. Practically, it may lower your risk of uncomfortable conditions like prostatitis. Reason number 2, it lowers inflammation and stress hormones. When you orgasm, your body naturally reduces cortisol, the stress hormone. Why does this matter after 60? Because high cortisol is linked to chronic inflammation, higher blood pressure, and weaker immune function. Studies from PubMed and the NIH show that balanced sexual activity lowers systemic inflammation. For men with enlarged prostates, where inflammation plays a key role, that's a huge benefit. This isn't just about biology. Emotionally, lower stress means calmer moods, better patience with your family, and a stronger sense of control in your day-to-day life. Reason number 3, it supports blood flow and nerve health. As we age, blood circulation naturally decreases. That affects not only erections, but also the health of pelvic tissues. Ejaculation stimulates blood flow through the entire pelvic region. It keeps nerves firing, tissues nourished, and blood vessels flexible. It's like exercise for your reproductive system, and just like your muscles need movement, your prostate and nerves do too. Practically, this means better urinary function, better sexual function, and less discomfort. Reason number 4, it maintains hormonal rhythm. Your body isn't just mechanical, it's also hormonal. Regular ejaculation helps keep testosterone and related hormones in balance. When your hormones stay balanced, your energy, mood, and even motivation improve. Men often tell me they feel lighter and more relaxed after release. That's not just in their head, that's chemistry. Reason number 5, it connects you to your own body. This last one is often overlooked. Regular release keeps you familiar with your own anatomy. Many men have discovered early signs of prostate issues, testicular changes, or other concerns simply because they knew what felt normal for their body. That awareness can literally save lives. Now, I want to be crystal clear. Masturbation is not a magic bullet. It's one tool in a larger toolkit for prostate health. If you're ejaculating daily but ignoring diet, exercise, and sleep, you're missing the bigger picture. So let's talk about 5 other daily habits that protect your prostate. Habit number 1, nutrition that calms the prostate. The prostate is very sensitive to diet. One nutrient in particular stands out, lycopene. It's found in tomatoes, watermelon, and pink grapefruit. Lycopene reduces oxidative stress inside prostate tissue. A large study found that men with the highest intake of lycopene had a significantly lower risk of aggressive prostate cancer. Other foods help too. Green tea, rich in anti-inflammatory compounds, cold water fish like salmon omega-3s. Cruciferous veggies like broccoli and cabbage support hormone detoxification. What you eat shapes your prostate just as much as what you do. Habit number 2, daily movement to keep blood flowing. Circulation is life. When you sit all day, especially with poor posture, blood flow to the pelvis slows. That can worsen prostate issues. You don't need marathons. Just 20 to 30 minutes of walking, stretching, or even pelvic floor exercises. Kegel-style exercises for men can improve urinary control and sexual function. Think of movement as oiling the gears. Without it, things stiffen. Habit number 3, sleep to reset your hormones. Deep sleep is when testosterone peaks. Poor sleep means lower testosterone, more belly fat, higher estrogen, and more inflammation in the prostate. To improve sleep, avoid caffeine after 2 p.m. Keep your bedroom cool and dark. Cut screens an hour before bed. Try magnesium or tart cherry juice for natural support. Better sleep equals better hormone balance equals better prostate health. Habit number 4, fight inflammation, the silent enemy. Chronic prostate inflammation is common in older men, but it's not always from infection. Often, it's lifestyle-driven, high sugar, processed foods, smoking, stress. Research shows that anti-inflammatory diets and stress reduction can improve prostate symptoms as much as some medications. Daily ejaculation may help here too, but only if the rest of your life supports healing. Habit number 5, release the shame. This may be the hardest one. Many men grew up hearing masturbation was dirty, weak, or shameful. That guilt doesn't just live in your mind, it affects your body. Chronic shame raises cortisol, lowers immunity, and disrupts hormones. You're not broken, you're not weak, you're simply responding to a biological need that your body is wired for. When done mindfully, without guilt, without compulsion, it becomes part of your healing. Now let's address a question I know some of you are thinking. What if I have high blood pressure, diabetes, or an enlarged prostate? Is it still safe? In most cases, yes, moderate ejaculation does not worsen these conditions. In fact, by improving circulation and lowering stress, it may actually help. But, and this is important, if you've had recent prostate surgery or if you're on certain medications that affect libido or blood flow, talk to your doctor first. Remember, this video is here to inform you, not replace medical advice. Let's recap. Masturbation is not a shameful leftover from youth. It's a natural function, one that your prostate may actually depend on. When done regularly, gently, and without compulsion, it may reduce inflammation, flush out harmful buildup, support blood flow and nerve function, balance hormones, even lower your long-term risk of prostate cancer. But it's just one piece of the puzzle. Your diet, movement, sleep, mindset, and stress levels matter just as much. True prostate health is a lifestyle, not a single habit. So what does daily masturbation do to your prostate? The shocking truth is, far from harming you, it may be one of the simplest, most natural tools for protecting your long-term health. And that, my friends, is something worth talking about openly. If you found this video valuable, give it a like so more men can discover the truth. And don't forget to subscribe and hit the notification bell so you never miss our next conversation. Now, I'd love to hear from you. What was the most surprising thing you learned today? Drop it in the comments below. I read every single one. Remember, age is not the end of vitality. With small daily changes, you can reclaim comfort, freedom, and confidence. Stay healthy, stay hopeful, and I'll see you in the next video. Dr. Nora Hayes,